Okay, this is Dr. Jolene Brighten, and I'm here today to talk to you about estrogen dominance. So, estrogen dominance is actually something that's really common, and often women will think, well, this is something that just affects a woman when she first gets her period, or it's a situation where they'll think, well, that's something I don't have to worry about until perimenopause. Those are definitely times where women can see a lot more estrogen dominance and other hormonal symptoms, but the truth is that estrogen dominance can affect any of us. I want to say at any time, and that sounds pretty ominous, so that's really not my intention, but here's the deal. We are in a really interesting time where in our environment we are being hit with more chemicals than our human body has ever experienced. And I mean, from a generational standpoint, we're talking about a very unique time in history where we're exposed to chemicals in our personal care products, just being outside, you're exposed to chemicals, and in our food supply. And our food supply is actually a kind of scary place to navigate when it comes to wanting to have awesome hormones. So, estrogen dominance. First thing I want to talk to you about is estrogen's role in the body. Now, there's this trend going on, I'm not sure what's up with it, but where I see that women who are menstruating, they tend to vilify estrogen, and they're like, estrogen's the worst, it causes all these problems. And women who are in menopause tend to worship estrogen. Like estrogen, they're now missing and they're feeling the effects of that, and it's just something to be attained. And, it does make women feel a lot better. Estrogen's not bad. There's not a single hormone that is bad. In fact, they just all need to be in balance. So here's the deal with estrogen. It is responsible for building up the endometrial tissue in your uterus and getting you ready for a baby. Now, this is always the part where people are like, I don't really care. I don't want to have a baby. I hear that from a lot of women. Regardless if you care about having a baby or not, that's your decision. I mean, that's the bottom line. It's your decision, and it's no one's business. But, whether or not you want to have a baby, it's still important to have adequate estrogen levels. Estrogen is why we have breasts and why we have hips, why we have our curves, right? Estrogen is also a big player in protecting our mood and protecting our brain overall. It protects our heart and it protects our bones. Estrogen is not just about the menstrual cycle, but to go back to the menstrual cycle, estrogen is going to be building up the endometrium. So getting the endometrium, getting the uterus ready for a baby. So the problem with estrogen dominance is exactly what it sounds like. When there's too much estrogen being produced in the first half of the cycle, or relative to your progesterone, which is actually a lot more common. So what does estrogen dominance look like? Estrogen dominance, when women are experiencing too much estrogen in their system, they're going to have things like headaches, especially headaches that come on in the beginning of the cycle. So you have your period until about mid-cycle, which is when you're ovulating. Having headaches in that period of time can be estrogen. If you're having headaches in the second half of your cycle, though, this is kind of the tricky part, it could still be estrogen if your progesterone levels aren't adequate. So headaches, definite. Weight gain. This is a big one. So in my practice, I don't specialize in weight gain. I don't treat weight. So that's my big thing. Excuse me. I am not going to treat you to help you lose weight. We can help you gain weight, but we don't look at it from that lens. In fact, the way we look at it is, well, your body should be in a homeostasis/homeodynamic. It should be able to fluctuate weight, but find itself back in that balance point. So why do I say I don't treat weight? Well, because there's usually an underlying cause, and that's actually what I treat. So in this instance, estrogen dominance can actually be an underlying cause of women gaining weight. You're actually going to gain weight in your hips, butt, and thighs, which might not be too terrible. But, if that's your problem area, it's likely that it's estrogen. Opposed to cortisol weight gain, which is usually that mid-belly fat, that midsection belly fat, that's more of a cortisol issue. But too much estrogen, you're going to hold on to your weight, especially in the lower half of your body. And it's going to be really hard to get rid of your weight because estrogen stimulates your fat cells and asks them to store more fat. And it's not helping your metabolism. Estrogen also will block your thyroid hormone from being utilized. And it does this by so this beautiful mechanism in your body. Let me back it up. When estrogen elevates, your body should also raise sex hormone binding globulin. But what we see is a sex hormone binding globulin comes up, which is a protein to grab onto that excess estrogen. Another hormone, thyroid binding globulin, also comes up. So now we have an issue that too much of our thyroid hormone is actually bound. So can't use it. So that's another way that estrogen dominance can contribute to unwanted weight and weight gain. Again, there's a root cause. We have to go deeper and we have to understand what's happening. So other symptoms of estrogen dominance. Let me just ask, the people that are on here, are you feeling this? Are you familiar with any of these symptoms? You can show me little hearts or likes if you're feeling this. So estrogen dominance symptoms. Let me go back to that. So we talked about the headaches. We talked about the weight gain. Breast enlarging, being swollen, being tender. That can be a symptom of estrogen dominance, as can heavy periods. Heavy periods can be a sign of estrogen dominance. This is a really important one to work with the doctor on. It might be estrogen dominance. It might be iron deficiency. I don't want anyone supplementing with iron unless you know your levels. You've got to get a lab test because that stuff can be toxic. So those are some of the symptoms of estrogen dominance that, are visible or that women can really see in their body. Some of the kind of hidden symptoms of estrogen dominance is being really irritable. Mood swings can definitely be an issue with it, and it takes a little bit of blood work and more history taking, so understanding your story to understand, is it estrogen, is it progesterone, is it both? Because that's a possibility, right? Don't ever let anyone tell you that the female body is not complicated. It definitely is, which is important to recognize that if you are struggling with hormonal symptoms and you are feeling kind of shamed or, frustrated you can't figure it out, this is really complicated stuff. So that's why I'm doing these videos. I hope it's going to really help you. And I hope that, you will start to be able to navigate your body and your health a little more clearly. So estrogen, again, not all bad, but it definitely, if you've got too much of it, then you can have some symptoms like the irritability, the headaches, the weight gain that we talked about. It also can affect your mood. And so, the irritability is one thing, but the mood swings, they can be pretty drastic. And as estrogen fluctuates, we can see symptoms of anxiety, which can be how it's interplaying with progesterone, and also depression. If you're not having enough estrogen, that can definitely be problematic as well. So what's causing this? Why are we seeing estrogen dominance? Well, the first thing I talked about was we live in a really unique time in which women are exposed to a whole lot of chemicals. Now, don't get me wrong, men are definitely exposed as well. But you notice that I have mascara on and some lip gloss and I used some coconut oil today, not lotion. But a lot of our personal care products are full of endocrine disruptors, and also our food supply. So this is really important because diet's really important with estrogen dominance, but to recognize that, there's this, kind of toxic soup that some of our food sits in. Things like BPA laden cans or getting water bottles, drinking out of plastic water bottles, which, I have traveled plenty, and I know that sometimes that is the only option. So it's not worth beating ourselves up over, but it's definitely something to take note of and not to make our daily practice. In fact, BPA that's found in our plastics, and don't drink out of that BPA-free stuff either because that BPA, substitute is just as bad. But BPA, in addition to, contributing to this estrogen dominance, it also can bind to proteins in your body and trigger autoimmune disease. So that's another reason to make sure that you avoid drinking out of plastics, eating out of plastics, don't microwave in plastics ever, and really, really tend to your food supply. And, as much as you can get from the farmer, you can grow yourself, or you can actually track down where your food came from. I think that's really important. So another place where estrogen dominance can come in from our environment is from our meat sources. Now, whether or not you eat meat, if you're eating a lot of soy, that can actually contribute to estrogen dominance as well. So take heed on that. But, whether or not you're eating a whole lot of meat, it doesn't matter. If you're eating meat and it's not organic, we've got a problem. And the reason for this is because, the name of the game in the food industry is like, let's just pack on as much weight as possible into these animals and get them, out and to the supermarket basically as quickly as possible, which includes feeding them lots of grains, which are inflammatory. Inflammation can definitely contribute to estrogen dominance. And then they're being given hormones and antibiotics. So definitely the hormones are an obvious problem, right? But we're going to talk a little bit about antibiotics and about your gut health as well today. So I'm going to be jumping into that some more. So here's the deal. If you're not eating grass-fed organic meats, you are exposing yourself to hormone-disrupting chemicals. And these animals being stressed out and inflamed, you are what you eat is a very literal thing. What you eat gets integrated through your digestive system and goes into every cell of your body. Whatever you consume, that's what you're made of. So it's very important to take note of. That's how important your food supply is. Okay, so we're talking about estrogen dominance. If you're just joining us, I'm Dr. Jolene Brighten, and we were talking about what are the causes of estrogen dominance. And the first one I started with is what's going on in our environment. The second big one I'm going to talk about today. So the first was environment. The second big thing I want to talk about is your adrenal health and your stress and your progesterone. So all those things going together, because I said before, estrogen can be high because of exogenous estrogen, because of your fat cells, because of a lot of reasons. There's actually a lot of reasons to have estrogen dominance that I'm not covering today. But this other one, this stress, progesterone, adrenals, what's going on with that? This is actually a really common reason. I mean, I would say the environmental cause and the stress cause are the two biggest reasons I see estrogen dominance in my practice. So what's going on with this? Okay, you are now pumping out all this cortisol because you're stressed. Whatever the reason, you got stress, you got chronic stress. Hey, Katie, thank you for the question. I will definitely talk about loss of cycle in just a second. So the stress, you pump out all this cortisol, you don't make as much progesterone. Now progesterone's down in the second half of your cycle, but you're still making your estrogen. You now have a relative estrogen dominance. It's not that you made too much estrogen to begin with, it's just that you're not making enough progesterone. Again, no bad hormones, just have to have them in balance. And estrogen and progesterone must always be in balance. Okay, so estrogen dominance contributing to a loss of cycle. So amenorrhea, which is the loss of cycle, thank you for asking this, Katie. So that's usually an issue with too little hormone production. But here's the deal. It can actually come from several places. So estrogen dominance causing the loss of your cycle. If you're not making progesterone and your progesterone doesn't drop, you won't trigger yourself to have a cycle. Estrogen shouldn't be going on throughout your entire menstrual cycle, so it's definitely a problem if it is. If you haven't had a menstrual cycle, there's another really important hormone to look at, and that's prolactin. And I love the hearts. Thank you for the hearts. Those little things like hearts make us so happy. So prolactin, this is actually produced from the brain, and I should back up. So prolactin can actually be due to a pituitary tumor in the brain that can cause us to lose our periods. Also, not having adequate fat in our diet can cause us to lose our periods. There's a lot of reasons to lose your period, and often too little estrogen is at play there, because when there's too little estrogen, we often see that the endometrium can't flourish, and we're having issues with our bones and other tissues. Are you an athlete at all, Katie? I'm curious if you're an athlete, because there's a condition known as the female athlete triad, where women exercise a lot, and I'm not going to judge that because you're an athlete. That's your thing. That makes you happy. Great. They don't eat adequate calories. It's not an eating disorder, it's disordered eating. And what that means is it's not enough calories relative to the energy expenditure. So it's really important, because I hear a lot of clinicians, a lot of doctors, healthcare practitioners saying, oh, it's because you have an eating disorder and you're an athlete. You know, an eating disorder needs to be diagnosed by a professional that deals with that. But, you know, it's usually disordered eating. It's not that the woman doesn't want to eat. She just doesn't understand the caloric needs for the energy expenditure, because every sport has its own metabolic output. And for instance, if you're in a pool, burn calories a little differently because you're exposed to water. So, you know, the female athlete, try it, you can see all of that, and you'll see the amenorrhea comes on. You don't have your period anymore, and we start to see fractures after that. And it's because of too little estrogen. So, you know, that's more common, is the too little estrogen. But the reason why I bring up the prolactin and to definitely look at, I mean, this is an algorithm. This is what every physician follows, is that we definitely check prolactin anytime there hasn't been a period. I alluded to like a pituitary tumor, and I'm like just glazed over that because it's normal in my world, but that's not cool because it's not normal in your world, and I might have freaked some people out. Katie, I hope I didn't freak you out. Not my intention. But I actually have diagnosed 2 of these in the last week, of women who are not having their periods, and we sent them for an MRI. So I got their prolactin, it was elevated. We sent them for an MRI. Turned out, yeah, they had a pituitary tumor. And these are just 2 women who had come to me after they had seen everyone and done everything. And my job as a physician is to say, well, have you really done everything? What haven't you done? What's worked? What hasn't worked? And where can we still dig deeper? So let me see. Katie said, not an athlete, and I have issues with my bones. Always am weak. Trying to eat all organic and no soy. That's good. You got to get your hormones tested. So, you know, it's great that you try to eat organic. You know, if nothing else, everyone who's listening, Clean 15, Dirty Dozen from Environmental Working Group, follow that, because the pesticides they spray on your fruits and vegetables, they hate your hormones. They just hate them, and they just beat them up, and they block receptors. They're big old bullies. But I get that not everyone can eat everything organic. I totally get that. It's definitely a budget issue, and you can grow a lot of your own food. This is something that there's a great book, Urban Homestead, I recommend to anybody who lives in an apartment or in just an urban part of the country. And it's something I give out to my patients because you can grow your food even in an apartment. Oh, what about cookware? Good question. I love that, Alma. Cookware. So that Teflon, again, it's just like anything that makes your life a little bit easier probably comes at a price. Now we can't say that across the board for like everything, but I would definitely say if it makes your life a whole lot easier, if your eggs don't stick to the pan, which, by the way, I use stainless steel cookware, and the eggs sticking to the pan drives me insane. And every time, I actually don't complain about it anymore, because every time I would, my husband would actually say, well, it's that, or you can be eating Teflon and toxic chemicals. The other issues with Teflon, once you start heating it up, you're going to breathe those vapors in. That's another big issue. So definitely cookware and your plastic spatulas. Watch out for those, because man, show me like anybody on there ever burnt a plastic spatula on a stovetop in a pan when you're cooking stuff, because that's definitely happened to me. Like once upon a time, Dr. Brighten didn't know all these things, and I drank soda and ate Domino's pizza and just cooked with horrific cookware and drank everything out of plastic bottles. Like, I was totally that person, so don't judge anyone for having been there. Like, you learn better and you do better, and so that's all I want for every woman who's listening. So I saw some likes there. Thank you for for showing me some love and not then making me think I'm the only one who's burnt that plastic cookware. So definitely a good point about the cookware, and to pay attention to what you're cooking with. So the part about, I'm going to back up. We're talking about estrogen dominance today. If you're just joining me, I'm Dr. Jolene Brighten. And for everyone listening, I want you to know that I've got a free ebook for you. And that can be found at drbrighten.com/hormones. And so my last name's a little tricky. It's drbrighten.com/hormones. You can grab an ebook. I talk all about estrogen dominance on there, and there's a whole supplement guide that's going to come with that as well. So, if you're wanting to dig even deeper into this and into this topic, like, grab that ebook and definitely, educate yourself about your hormones, because the reality is not a lot of doctors, not a lot of health care practitioners really understand female hormones. And it makes it a really big problem because, well, one, doctors like me are having to help a lot of women who should have been helped a lot sooner. And two is we're being offered things like birth control pill and anti-anxiety medication for things that are hormonal symptoms. That's not root cause resolution. That's a big disservice to women. And the best thing you can do is educate yourself about your hormones and educate yourself about your body overall. Be your own advocate. So let me go back to what I was saying about estrogen dominance. We were talking about the two main causes I wanted to address today. And one was the environment. And the second one is like, what's up with your stress? And I had already said, like, this is one of the biggest things I see in my practice, where, your hormones, they can choose where to go. And when you're stressed, the choice is very obvious. They drop right down into cortisol, and they negate your progesterone. You might not even ovulate. Like, you can have an incredibly stressful, like, workout and day, and like all the things are happening, and it'll delay ovulation by a few days. Like, that is how powerful stress can be on your body. But again, if you're pumping out cortisol, you're not pumping out progesterone, you don't have enough progesterone, you have too much estrogen. Like, that's just the way it goes. You bring down that progesterone, that estrogen is unchallenged now, you have relative estrogen dominance. And the problem is a lot of people are going to come in and they're going to say, how do we get all that estrogen down? Estrogen's high in the second half of your cycle. So let's have you take a bunch of supplements. Let's have you do a bunch of things to bring your estrogen down. And then you might start feeling depressed, and your breasts might sag a little bit. That happens too. And, maybe you're not in the mood anymore. And that's because, the problem wasn't that you were making too much estrogen. It was just relative to your progesterone. And the answer is, of course, lifestyle, bring down the stress, but that takes time. I recognize that. So the other thing is, bring up the progesterone and support the adrenal glands to do their job appropriately. And so that's when we start to get into adaptogenic herbs to support the adrenal glands. Again, if you grab my ebook, a free gift for you today, go grab it. I talk about adaptogenic herbs in there. I even tell you my favorites and how I dose them in my patients, like what are the good starting places. And I also talk about things to raise progesterone, like Vitex. And so you can get that all there. We're talking about estrogen dominance right now. So if you're just joining me, I'm Dr. Jolene Brighten, and you definitely want to go back and rewatch the beginning of this if you're just watching me, just now catching this, because we're definitely talking about, what is estrogen dominance and, what are the major causes of that. So the stress piece, to continue on with that. Thank you for the like. I love that. So the stress piece is huge, and it feels almost redundant, to many of us to hear about, yeah, we know stress is causing a problem, but not a lot of us understand that it is literally preventing you from being pregnant, from enjoying your life, from having a stable mood, from having easy periods. I mean, stress is hitting your hormones hard. So finding ways to de-stress, doing deep breathing exercises, going for walks, choosing exercise that's best for you. I actually, it was a little story today. I was in the gym this morning. I was lifting weights. I was a body pump instructor. I actually got certified I think almost 15 years ago. I taught it that long. Yeah, I taught it that long. So I was talking to a friend, and we were watching some of the women go into I was talking to my trainer, who's like my really good friend now, because she kicks my butt. Things I like about my friends, they challenge me. So we were talking about some of the women that were going in there, and she was asking me, can you look at people and identify hormonal imbalances? And I'm like, yeah, sometimes you can, and especially in a gym, it can be really obvious. Again, estrogen dominance, but hips and thighs, weight gain, okay? We've got an estrogen dominance, which might be due to the low progesterone, might be due to something else going on, or maybe the woman's just like going into working out. It has nothing to do with her workout. But something we did notice is that there were quite a few women going in with, I don't want to sound judgmental at all, but they had midsection belly fat. And so I am not at the gym checking you out, judging you. Not happening. I just want to make that clear. But I actually am a people watcher and I like to make observations. So I noticed these women going in, they had quite a, there was this group that had the belly fat. And so that's very cortisol. And that can definitely be an issue, with what's going on with estrogen, but that's definitely very cortisol. And, the thing that I noticed is that they actually stayed for the second class. And I went in to listen to what the second class was. I was like, I kind of want to check this out. And the instructor said, we're going to go hard for 40 minutes of nonstop cardio, and I'm going to push your cardio to the extreme. And in that moment, I realized why all these women had the belly fat. Because I'm like, why are they getting this from this like weightlifting class? How is this happening? Because of the high cardio. They were stressing their adrenals. Now, is cardio all bad? No, it's not all bad. But hey, if your work is stressful, your life is stressful, and then your exercise is stressful, all you have in this life is stress. And so you want to find exercises that are conducive to your body and finding that whatever works for you. You might need a little more yoga to reduce the stress. You might be like me who needs yoga and strength training. Like that's my perfect combination. And I push myself with the strength training to get the cardio. But you might need to be someone who's like, I do a little bit better when I alternate cardio and weightlifting. So again, there's never a one size fits all for everyone. It's all about you and your individual body. And I really want to drive that home because if you have a doctor that you're working with who's just like, this is my protocol for everyone, or like, I see this, so you must be this, like they're just not doing their due diligence and listening to your story. So how does alcohol intake affect estrogen dominance? So great question. That's Lauren. I was going to talk about that today, so thank you for the segue. Okay, so alcohol definitely affects estrogen dominance. In fact, there's been research to show I'm trying to recall my numbers, one alcoholic drink increased estrogen by 7%. So alcohol definitely affects us, and as women, it's a bummer, but we're really susceptible to alcohol. So in terms of our hormones, definitely, it can raise the estrogen. The other thing it's doing is it's bogging down your liver, which is really important. If you think you have estrogen dominance, don't bog down your liver. So you have estrogen dominance. Your liver's trying to process all this estrogen and you're drinking alcohol. No judgment. So I want to say that. No judgment about drinking alcohol. And I'm going to get back to that point. But you're drinking alcohol. Now your liver has more work to do. And what's more dangerous? Estrogen or alcohol? It's going to process the toxin out first. And alcohol is definitely seen as a toxin. So back to the no judgment about alcohol and why I want to say that. When our hormones are off, sometimes the only thing that saves our day is a glass of wine, a shot of whiskey, beer, whatever it is. And I totally get that. And this is a real thing. This is why, we see these shirts out there that are like, it's wine 30, or, these memes that go around that says, Mama needs a glass of wine. Like, it's because we're stressed out and our hormones are in balance. So that's not your fault. In fact, some days it's like your husband and your toddler and your boss's fault. It's definitely not your fault that you feel compelled to have that drink because, alcohol drops cortisol pretty quick. It doesn't beat deep breathing, but it, can definitely taste better in the moment and make you feel better. So I say that, I come from this place of like, I don't want to judge you for the choices you're making. Like, you're doing the best you can. You are doing the best you can. And if you are someone that reaches for a glass of wine every night, when I should back up and say, like, when I have a patient, so I work with a lot of women, I have a lot of moms, and this actually happens to moms a lot, and nobody really talks about it, where they're cooking with wine and then they're drinking wine, and every day they have to have that glass of wine. That's not about them being an alcoholic, which is certainly the first thing that they get called. if they disclose that to people, it's about they don't have progesterone. Their adrenal glands aren't keeping up with like the amount of stress that's going on in their lives. Like they're not recruiting the hormones that they need. And that's not something I think we should go around judging anyone for. And it's not my place as a doctor to judge people's choices. It's my place to step back and say, okay, hold up, like what's going on here? And what's the underlying issue? I do that with alcohol and cigarettes. I don't go after, like, let's just stop drinking alcohol and stop having cigarettes. I first start with, well, why? Why do you feel you need these things in the first place? Because if we can get your hormones in balance, so we get them back into balance, you're not going to need that alcohol. Now, can you get your hormones in balance and be drinking tons of alcohol? No, you can't. You can't do it. So it's really something. If I have a woman with high alcohol intake and I know the hormones are struggling, we try to do it at the same time. So eventually alcohol comes down and the hormones are nice and balanced. So great question, Lauren, about the alcohol intake. I definitely wanted to talk about that because it stresses the body. Thank you for those thumbs up. I like the thumbs up. I feel like that was only something I ever did as a kid. Now that I have a kid, I get to be like, thumbs up all the time. So, okay, so we talked about the alcohol. Talked about the liver. You got to support the liver. So the liver processes estrogen and gets it ready to move out. Your bowels have to move the estrogen out. So this is a big underlying cause of estrogen dominance that doesn't get addressed a lot. So we talked already, so I should say, I'm Dr. Jolene Brighten. We're talking about estrogen dominance today if you're just joining us. We talked about the symptoms, we talked about estrogen's role in the body, and we talked about two major causes, which are our environment and our stress. But the third thing I want to talk about today, this is our little bonus I'm going to add in, is going to be talking about the gut and what's going on with the gut. So I definitely, if you're just tuning in, grab my ebook, drbrighten.com/hormones. It's Dr. Brighten's quick guide to balancing your hormones. This has a supplement guide list. It has a whole lot of information on estrogen dominance. So go and grab it for sure. But, in terms of right now, what I want to talk about your gut. Now, if you have constipation, you're not having a bowel movement every day, you probably are struggling with estrogen dominance because your body can't get that estrogen out. And so estrogen dominance, if you're just catching this, I already talked about its role with thyroid and how it can impact that. If it's keeping your thyroid from doing its job, your bowels are not going to move. You are not going to have bowel movements. If you have underlying gut infections like SIBO, small intestinal bacterial overgrowth, I diagnose and treat tons of that in my clinic because I work so much with hormones. And SIBO and hormones, especially hypothyroidism, too low thyroid, totally go hand in hand. So if you've got underlying gut infections, you have to address those as well as part of the piece of getting rid of your estrogen dominance. So I want to give you 3 things I want you to eat today. So 3 things I want you to go out and eat today to start helping with estrogen dominance. The first thing is flax seeds. Fresh ground flax seeds at 2 tablespoons every day will help increase that sex hormone binding globulin so it grabs onto your estrogen. It's a way for you to do it without raising your thyroid binding globulin as well. It's also going to give you extra fiber so that you can move your bowels. So 25 grams of fiber every day is what you want to aim for. Start with some flaxseed. Get the bowels moving. Second food I want you to go eat more of today, broccoli. Broccoli and the brassica family have a constituent in them called DIM. This is something that gets your liver detoxifying that estrogen. Now, should you just start DIM right away? Unless you're pretty certain you have estrogen dominance, I don't advise just going and taking a DIM pill. Excuse me. My family's been sick lately and I've been fighting it and I thought I was really successful until I tried to just talk to you guys forever. Bummer. All right, I'm going to have to just drink a little tea here. So, all right, broccoli. Why do we want to drink broccoli or eat broccoli and not take DIM? Check out my gnome mug, by the way. Okay, so broccoli is going to have a whole lot of other stuff in it, including minerals, B vitamins, beta-carotene, and fiber to move your bowels. If you go and take DIM, you can drop your estrogen too fast. Now, if you have those major symptoms, you get my ebook, you're like, yeah, I'm definitely estrogen dominance. It's not going to hurt you to try some DIM. But you're not sure or you haven't been working with a doctor, Taking DIM could drop your estrogen levels, and that can contribute to mood symptoms, and definitely, you're not going to feel your most voluptuous, sexiest self. And that's important for women. We need to feel confident. So in terms of broccoli, if you can get at least a cup in 3 times a week, you're going to be fighting off a lot of, chronic disease, and you're going to be helping with that estrogen metabolism as well. And so first food I wanted you to eat, flax seeds. Second food was broccoli. And the third food is, I'm actually going to say, go eat some shiitake mushrooms. Those are going to have minerals in them, including magnesium, which is going to help with your estrogen metabolism. And it's going to have B vitamins, which is going to support your production of your hormones, including cortisol, estrogen, progesterone, and your detoxification pathways of those. Okay, so I'm going to hang out for a few more minutes and I will take some more questions. Again, thank you, Katie and Alma and Lauren, for asking your questions, and Katie for clarifying those things so we could talk more about the estrogen dominance. Again, I'm Dr. Jolene Brighten. You can grab my free ebook, which is Dr. Brighten's Guide to Balancing Your Hormones. And that's going to have a whole supplement guide in there. It will take you through what's estrogen dominance, what's progesterone deficiency, help you start identifying what might be going on. And I go a step further to talk about the foundational work I do in my practice, root cause steps to really addressing your hormones. Because it's not about taking estrogen. It's not about taking progesterone. It's not about, taking adaptogenic herbs only for your adrenal glands. It's about treating you as a whole person. I love the hearts. Thank you. But treating you as a whole person, respecting your story, and acknowledging that you are the only person who knows what normal is. And that is very important, ladies. If you go to a doctor and you're like, something's not right, and they're like, no, everything's normal, your labs are fine, here's a antidepressant, anti-anxiety, or birth control pill, walk away and find a second opinion. You are the only person who knows what's normal in your body. So if something feels off, you're right, something's off. All right, I hope this has been really helpful talking about estrogen dominance. Definitely, if you haven't yet, jump on my email list. I announced there today when I'll be on Facebook Live. I got a lot of positive feedback, comments, and emails. Thank you so much. Thank you for those hearts. Kathleen, thank you for joining me. But seriously, after my last Facebook Live, I got a lot of love from you guys and a lot of questions. And so I spent a lot of time answering those. So, the most logical thing next was estrogen dominance after my next one. I am going to respond to your questions. Let me know how I can help you with your hormones. And I would be more than happy to jump on a Facebook Live and answer your questions. Talk about whatever you like. And I have some special stuff coming up in the future. I am really, really excited. I can't say anything right now. I'm really excited about some really cool things I'm putting together to help you with your hormones more, because they're your hormones and it's your body. And I think as doctors, it's really our role to make sure that every woman understands what's happening in her body. No matter how complicated it is, we can help communicate that to you so you can understand. Yes, you may be experiencing a whole lot of symptoms, but there are underlying causes. There are root causes for that. And if we search for the root cause and we address that, we can get you long-term, lasting, I'm talking sustainable relief. So again, I'm Dr. Jolene Brighten. Thank you so much for joining me today. And I hope you're having an awesome day. Take care.